Good afternoon, folks. Robert Chappell here, Executive Editor, Madison365, with your daily update for Tuesday, January 4th. Back in the home studio here, trying to get my stuff calibrated properly. There we go. All right, a couple things today. We talked yesterday about some numbers that were looking very bad thanks to Omicron. Today's aren't much better. They're actually considerably worse, but not as much worse as one would have feared, perhaps. We'll see. Today we are reporting 8,058 new cases. That is, by the way, just as an aside, we passed 1 million confirmed cases in Wisconsin yesterday. I didn't think that was a particularly meaningful number just because there's probably a lot more than that, to be honest. But anyway, this is the third day that we've seen 8,000 new cases in a day. Back on November 11th, there were 9,000 and something. November 11th, 2020. Not this past November, but the year before that. And then the 12th, there was over 8,400. So today's the third time we've hit 8,000 cases. And that puts our 7-day average at 5,711. And now that I'm saying that, I'm not sure we actually reported 9,000 cases in a day. I think those are the positive tests that were taken on November 11th, but they may not have been all reported or confirmed that same day. But in any case, it's not our biggest day of cases yet, is what I'm trying to get at. And it's not our highest ever 7-day average. Our highest ever 7-day average was November 17th at just under 6,500. I think we will get there very soon. I would not be shocked to crack 10,000 cases in a day this week, just the way Omicron's going. So that 8,000 cases is not shocking. It's a very big number. It's a problematic number only if it leads to lots of hospitalizations and deaths. Okay, so we'll get to that in a minute. The 7-day positive test rate is the other number that has me really concerned. In that, you never want to look at one number in isolation, right? You look at trends. And the trend line from looking back to like December 26th or so, a little over a week ago, we were at a very high, very bad 15.5% positive test rate. From there, it's a straight line up. It's like literally straight up from 15.5 to 21 on the 29th to 24.6 on New Year's Day to now they're saying yesterday, we reported it at 24.5 yesterday. It has now been revised upward to 24.9. And today we're reporting 24.1. Although if the pattern continues from the past 3 weeks, 4 weeks, they've been basically revising that positive test rate up each day for the previous day. So I would not be surprised if tomorrow we come back and say that today's positive test rate is actually over 25%. For right now, it's being reported, given the data we have, at 24.1. So, as I mentioned, all these new cases and all this virus spreading everywhere is only a problem if it leads to hospitalizations and deaths. So let's talk about those numbers. Let's talk about hospitalizations first. This hospitalizations did jump again by 60 today, which is not as big a jump as we saw yesterday, right? We saw a big jump over the weekend. From Friday, we went from 1,715 to 1,903 yesterday. Today we're at 1,963, which is high. Our highest ever was back in November 2020. We were almost 2,300 people currently hospitalized. So we're approaching that, frankly. Now, that's a 291 more than a week ago. that's a pretty steep increase over a week. Yeah, that's like almost. Is that right? Am I doing this right? Math right? Is that like a 15% increase? I was an English major, so like math in my head is hard. So I'm gonna just do a little calculation here. Sorry, I know this is riveting television. Yeah, that's a 17% increase in a week. Just because this is a good comment, and I will address this. Let me get through the numbers, but then we'll talk about this. This is actually a good point. Okay, so that's a 17% increase in a week in the number of people hospitalized with COVID. Now, the ICU population, slight relief that it did not go up yesterday or today. So 462 people currently hospitalized in intensive care. That's an increase of 0. Okay, that is an increase of 57 from a week ago. 12, 13%, something like that. The problem with the ICU population, though, and this is, I got a question about this on Twitter yesterday. There are currently 35 ICU beds available in the entire state of Wisconsin. There are 0 ICU beds available in the entire Fox Valley region. In the North Central region, there are 3. In the Northeast, which includes Green Bay, the 3rd largest city in the state, the Northeast region has only 4. The Northwest region has only 4. The South Central region, which includes Madison and a little bit east of Madison, and then all the way down to Grant County in Platteville, down all the way down to the corner of to Dubuque, Iowa, basically, only has 11. The Southeast region, which includes Milwaukee, as well as Racine and Kenosha, some of the largest cities, has only 12. And the Western region, which includes Eau Claire, La Crosse, those areas, has 1. So here's the question. The question I got on Twitter yesterday was if there are 460 something people in the ICU with COVID, the total, all the hospitals in the state, there are 136 hospitals in the state, and between them they have 1,353 ICU beds. So how is it that they're almost all gone? And the answer is relatively simple. ICUs are used for other things. And at any given moment, there could be 800 to 850 people in ICU, especially this time of year. Right? People like me are getting a little older, don't get enough exercise all year, and then go decide to shovel snow and then have a heart attack and end up in the ICU. I shouldn't laugh at that, but that is 100% how I will land in the ICU. I will not exercise for 3 weeks and then decide to go shovel 4 feet of snow. Anybody who has heart surgery, anybody who has brain surgery, anybody who has any significant surgery at all, after surgery, you spend a day in the ICU. Often. Not every time, but often. If you have a stroke, you go to ICU for a bit, right? So any given moment, any given day, there could be like 800 people in ICUs across the state of Wisconsin, which in a normal year would be not a problem because the rest of the state would still have like 500 available ICU beds. Okay. Now, the other factor, which I have heard anecdotally, and I can't report this as news, okay, this is bad journalism, right? I can't confirm this as actual news, but I've heard anecdotally that it's not just about the emptiness of the bed, but it's also about the staffing. That there may be somewhere in the state, and I've got to do a little bit more digging to get this information, but there's some talk that there are empty ICU beds in the state that don't have enough nurses or doctors or technicians, medical assistants, healthcare professionals to make them available. An empty bed is not necessarily available, right? It's only available if there's medical staff to take care of a person in that bed. So that also might be a factor in driving down the availability of ICU beds because the staffs are just so short right now. and they're going to be for a while because people are getting COVID and having to isolate and quarantine. Not to mention, it's flu season also, right? People get really sick with flu too. And if you're an ICU nurse, you're not supposed to be working if you have the flu, right? So there's a lot of factors go into that. So those are the numbers. Oh, let me mention deaths. The 7-day death average actually fell a little bit, which is decent news, down to 20. Our 7-day average of confirmed deaths is 20 per day. That includes 35 reported yesterday. That puts our total confirmed death count at 10,133. I would anticipate that going up. The way I'm thinking right now, and my speculation, based on nothing but looking at this data every day for 2 years, is that our death rate, our 7-day average of deaths per day, will go up, continue to go up, but won't peak as high as it did last year. It'll peak, 4 to 6 weeks after the peak of new cases, whatever that is. But if we peak at 10,000 cases per day for 7 days, like we will hit 60, 70 deaths a day. If we peak at 6,500 cases a day like we did last year, we'll peak at 45 deaths a day. Right. So my hope is that the deaths will continue to go up, but they won't go up as high as they did in 2020, in November 2020. And then the cases peaked in mid-November, the deaths peaked a few weeks later, just because that's how it goes. So we will wait and see by the end of January where we are on deaths. My fingers are crossed that they will go up and peak in the 35 to 40 range instead of the 57 to 60 range like they did in 2020. So we will keep an eye on that. Now, the question that Jessica brings up, and some of you have responded, the death rate is the same as before. No, it's not. That's what I was just trying to say, Joel. It's a little bit lower. That based on preliminary, looking at obviously very preliminary, we won't know for sure what the case fatality rate ends up being for another couple of years probably. But comparing trends and stuff, it looks like to me in Wisconsin, the case rate or the case fatality rate, the death rate, has fallen from about 1% to about 0.8%. Not a huge drop, but I think it's significant enough that if we peak at the same number of cases as in 2020, we'll peak. Our deaths will peak lower, right? I'm not seeing Wisconsin. I'm not seeing it way lower. I can hope that it's way lower. I don't think it's going to be way lower. It's going to be noticeably lower, statistically significantly lower. I'm not sure about how much lower, though. We'll wait and see. We can hope. But again, it's not the same. It's low. It is lower. It's unquestionably lower. The question is how much lower. And what's an acceptable rate to you? You know what I mean? Like, if it gets down to 0.5%, is that fine? If we're losing 15 people every day instead of 20, is that okay? Is that a reason not to get vaccinated or not to mask up or whatever? I mean, those are the trade-offs, right? That's the question. But back to Jessica's question about shutting stuff down. Nothing's going to close down. Like, I'm just going to say that unequivocally. The state Supreme Court has unequivocally said in March of 2020, way back at the beginning of this, that the governor's office or that the State Department of Health Services does not have the authority to issue shutdown orders of basically of any kind, or mask mandates for that matter. So the only way that anything would shut down is with the cooperation of the legislature, which I don't see that happening. And it sounds like this Omicron surge will be relatively everything will be crazy high numbers, but for a relatively short period of time. Right. So we'll, ideally, it sounds to me, and I'm not. Joel, that's a terrific question, Joel. I'll get to that in a second. But the by the time the legislature could actually meet, and discuss it, like Omicron wave could be over. Like we might be out of the woods here by mid-January. Might be. Like that's the most optimistic view. That would not out of the woods, but it would be peaking by mid-January, and then on the way down, by the end of January into February, which would be great. And it would be great if we do that without significantly increasing the death rates. Right. But I don't see any shutdowns happening. A few school districts, have gone virtual temporarily or even extended their winter breaks, mostly for staffing purposes. Because the staff were out because of the quarantining. DJ, that's a great question too. I will address the IHU variant, which is not. It is far less infectious than Omicron. You may have seen headlines that said it was more infectious than Omicron. It is not. Those are false. But first, let's get to Joel's question, which is a terrific question. How do they account for all the home testing? Apparently, negative tests. Do you know how many tests are being sold? It would affect the rate. Yes, that definitely does affect the rate. The question is how they're accounting for those. They are not, as far as I know. The only way it would affect the positive test rate. It certainly does affect the positive test rate a little bit. The only way it does that, though, is if somebody takes a home test who otherwise would have gone in to get tested, right? Which I speculate is a relatively small group of people. There are a relatively small number of home tests. I think there are a lot of home tests being done. That's why all the shelves are empty when you try to buy a home test. But I do not think all those people that are doing home tests on a pretty regular basis would have gone in to get tested had they not had home tests available. And the reason I speculate that, again, it's speculation, the reason I say that is that there are still a lot of people in line to get tested by the state, or by the county, rather. At least here in Dane County, they had to extend the hours of the couple of county testing sites that are currently open, and they're looking to expand to reopen Atlanta Energy Center. Right. So that's, relatively several thousands of people who are getting tested by the county, who will be, count in the data. Joel, you say that at least 50 people exposed last week that did home tests. I believe that. I probably know that many too. The question is, how many of those 50 who were exposed would have gone in to the county to get tested, or how many of those would have said, okay, I'm exposed, I'll stay home. 3 days later, I don't have any symptoms, everything's fine. That's the only way that the rate would actually be affected, is if they're doing home tests instead of going to the county. It might be a statistically significant numbers. It might not, though. I do not believe that it's significantly impacting the positive test rate. It might be, and that's something that some academic researcher will look at 5 years from now. But in any case, it would be snazzy if there was some easy way to report a negative home test to the state. That would be pretty cool. That would help out a lot. I think that would help us have more confidence in the rate. But even if we say, okay, accounting for home tests, we still want the positive test rate to be like 5 instead of 3, right? And it's pushing 25 right now, which is pretty bad. There was another question here that I wanted to get to. Oh, the IHU variant. DJ mentions this is going around today online. And I don't mean to be dismissive, but I did look into it. This variant, it's called IHU because I don't know what IHU stands for, but IHU is the name of the institution, the research facility that discovered it. It has 46 mutations as compared to what? I don't know. 46 mutations from Alpha or from Delta. I don't know. But has only been observed in 12 people. And it was actually sequenced before Omicron. So it's a variant that they're watching. It's not new today. It for some reason popped on like sort of fringy online news websites today. And there were a couple of headlines like it's more infectious than Omicron, and there's absolutely no evidence for that at all. I think those are clickbait headlines, I'm afraid. Some news sites need you to click to make money. So they want to scare you into clicking. And that's what happened. And I clicked it. I'm not criticizing anybody who clicked it because I was, scrolling through Twitter on my phone and I see this and I go, oh, what's this? Oh, and then you Google a little bit and you see it's been around for a couple of months. It's still only been identified in 12 people. Those 12 people were pretty sick. It sounds like it was pretty bad, but it's not more infectious than Omicron as far as anybody knows right now. So hope that is helpful. This is a good question, Jessica. I would say, just my personal, I don't want to give you medical advice, obviously. But as far as I know, as far as I can tell, outdoors is still relatively safer. These last couple of weeks, anytime I've been outdoors, I've always had a mask with me. I've always been masked indoors, obviously. But I have not been masked outdoors unless it's a crowd, right? I would, if it were me, I'm still, obviously, I'm okay, like going to grocery stores and stuff like that, but I'm not sure I would go to like an event where people are indoors in a relatively large group. That's just me, though. But you've got the N95 that protects you as well as others, so I think that helps certainly. I'm hesitant to do indoor stuff right now. Certainly, I'm much less hesitant to do outdoor stuff. I think outdoor events. It's hard to do outdoor events in January in Wisconsin, but it seems like we're still in that place where outdoor stuff is pretty much okay. And if you're indoors, be masked. Assume, however, that you're being exposed to Omicron variant because it's really, really a lot out there. A lot. There's a lot of stuff out there. All right. If there are any other questions, great questions today, you all. I hope I've been trying to be helpful. I'm not trying to debate anybody. And I hope we don't come across that way. I'm just trying to answer your questions, which are all very good and very thoughtful questions. If you have any more, drop them in the chat. We're going to take a short pause. And so I can take a breath and get a drink of water. And then we're going to talk about some local news, including this is an important anniversary in the history of American democracy coming up on January 6th. We're going to talk a little bit about a local response to that, as well as some arts and some other stuff. We'll be back right after this. Stay with us. All right, thank you for sticking with us. A couple of local news items today. First of all, Madison Museum of Contemporary Art today announced that Fatima Laster, who is the guest curator of the Wisconsin Triennial Exhibition, has made her selections for the 23 artists that will be displayed in the Wisconsin Triennial exhibit. It's going to be titled "Ain't I a Woman?" Features 23 women of color artists, some of whom you've heard of, some of whom you haven't. At least that's my case. When I read the list, I was like, oh, I know her. I don't know any of these others. So I'm very excited to see some new work by Wisconsin artists. Fatima Laster owns and operates a gallery in Milwaukee. She is the first ever guest curator of the Wisconsin Triennial. That, as the name implies, the Triennial is a every 3 years exhibit specifically of Wisconsin artists. And Momoka announced, I don't know, maybe 6 months ago, over the summer anyway, that they were seeking a guest curator for the first time. Somebody outside the museums, particularly a person of color, to try to diversify and bring a different perspective to this exhibit. Because it's easy, if you're like me, white Wisconsin guy, if I created an exhibit of Wisconsin art, it would be a lot of Wisconsin white guy artists, probably. Right? That's just our natural inclination. So they made an intentional effort to bring in a guest curator. They found this art gallery person from Milwaukee, Fatima Laster, who put together this exhibit. I'm not going to read off all the names for you right now. There are 23. Go to Madison365.org and you can see the roster. That exhibit opens in March and runs through October. So you get a lot of time to stop by and see that. And I'm sure we will have coverage of that as it opens later this year. Also today, we want to talk about January 6th. You might remember January 6th was the day that the United States Congress met to, in a ceremonial capacity, basically to count the electoral votes and declare Joe Biden the winner of the election. And while they were doing that, several hundred people broke into the Capitol and did some violence and tried to stop the process. To observe that anniversary, our friend Masood Akhtar, who operates an organization called We Are Many United Against Hate, is hosting a forum on domestic terrorism. It'll be moderated by Attorney General Josh Kaul. It'll include students from McFarland and Deerfield and Baraboo and DeForest, I think. And it'll be in McFarland. And it'll be, and also Department of Homeland Security. Department of Justice, lead counsel on domestic terrorism. Thomas Brzezowski will also be there. But it's a local consideration of that event, what it means, what the attitudes mean, and how we move forward as a republic, especially as a local response. And finally, today in national news, in sports news, the Washington football team has announced that it will have a new name. It will announce its new name on February 2nd, and its new name will not be the Wolves. I don't know why that's part of the announcement, but that is. And the other thing I don't know about Washington, why couldn't they just call it Washington for a year? Like, you remember what the old name was, right? I'm not going to say it because it's a racial slur. It's literally, their name was a racial slur. So they finally decided to abandon that. And rather than decide on a new mascot, they just called themselves the Washington football team, which is fine. But why not just say we're just Washington? Like, every sports commentator insisted on saying the Washington football team, which is just absurd. Just like Green Bay's playing Washington. Like, anyway. So I don't know why, but they announced today they will announce a new mascot, a new name on February 2nd, and they announced that it will not be the Wolves. I don't know why they felt the need to add that, except that maybe there was kind of an online push to be the Wolves or the Red Wolves. But there were branding issues, trademark issues, copyright issues surrounding that. So it's going to be something else. It's something that they say they're confident that the Washington, Maryland, Virginia area will get behind for the next 90 years. This is in the same context where I think there are still 30 high schools in Wisconsin that use Native American mascots, which is, problematic for obvious reasons. The Cleveland baseball team, when they take the field next year, will be the Guardians, which leaves only one, I think, Major League Baseball team with a problematic mascot, the formerly Milwaukee team. So that's, moving forward on that issue, finally, in the NFL. And hopefully, some more Wisconsin schools will follow suit. All right, that's all I have for you today. If there are no other questions about the COVID situation, I, again, expect You know, I don't want to tell you like brace for impact. Would definitely expect more cases tomorrow. I wouldn't be shocked to crack 10,000 cases tomorrow. I don't hope to. You know, it's not like, oh, I'm so excited to hit 10,000 cases. No, but I wouldn't be shocked if we do, just to be prepared. But I'm not trying to scare you. Unlike the people who are saying you that other variant is whatever. I'm not trying to scare you. I'm not trying to make things seem worse than they are. Right. I'm trying to be honest with you that for the next couple of weeks, the numbers of cases and the positive test rate are going to be high because there's not enough testing. There's a lot of cases. And as Joel points out, there's a lot of people doing home tests. Right. So those numbers are going to feel really high. But do they lead to hospitalizations? Do they do they overwhelm the hospital system? Do they lead to deaths? Those are the questions. Right? So far, the hospitalizations are up. The hospitalizations not looking great. The deaths, not so much. They're not rising as quickly. Okay? So we'll keep our fingers crossed on those measures. So I'm just trying to be honest with you that, you know, there's going to be some big numbers tomorrow, most likely. And then we have to look at what do those numbers mean in real terms, right? So that's what we try to talk through every day here. So that's what I try to do. All right, that's enough for me for today. Have a wonderful evening. Take care of yourself. Try to stay warm. Sounds like we might get a little bit of snow tomorrow. Might not. We'll see. But until then, have a wonderful evening, and we will talk to you soon.
This is 365 Media.